healthcare that's been a secret for far too long, and it's providing better treatment options for those living with uterine fibroids. Up to 80% of women will develop fibroids by the age of 50, and a common solution has been a hysterectomy. This afternoon, I want to introduce you to Dr. Phil Zeni Jr. with Zenith Health and Aesthetics to talk about their non-surgical and effective procedure that's providing relief to women. Good afternoon, Doc.
Good afternoon. Thank you so much for having me.
No problem at all. Okay, so let's first of all talk about what uterine fibroids are and how it affects women.
Fibroids are a benign growth that occur in the uterus. They're extremely common. Up to 80% of African American women have them, and they often cause symptoms such as heavy bleeding and cramping during menstruation.
Now, you mentioned a large portion of African American women have these. Do they affect all women? Do they affect all women the same way?
They do occur in all women, but much more common in African American women.
And you mentioned that it can affect menstrual bleeding and things like that. Is this happen with certain age groups? Does this happen to older women or middle-aged women?
Usually occurs obviously before menopause, but after the age of 25 to 30 is most common. They continue to grow up to menopause, and then after menopause they tend to regress after estrogen goes away.
So we talked a little bit about some of the symptoms and who it affects. What are some of the treatment options? What are some of the previous treatment options, and what are some of the ones that you guys are doing right now at Zenith?
So the traditional treatment for uterine fibroids is hysterectomy. And hysterectomy is the most common surgical procedure in the United States, excluding C-section. And the #1 reason for hysterectomy is uterine fibroids. The other treatment that is surgical is myomectomy, where they just try and remove the fibroids themselves. But I perform a new procedure called uterine fibroid embolization. And that works by blocking off the blood supply to the fibroids. And if you block off the blood supply to the fibroids will shrink and no longer cause symptoms.
Now, is this a one-time treatment? Is this an outpatient procedure? How does this work?
Yeah, so that's highly effective. More than 90 to 95% of patients who undergo the procedure will have relief from their fibroids. It's all performed on an outpatient basis. They come in the morning, usually leave by 12 o'clock. The recovery time is very quick, usually back to normal, I say, in 10 days versus after hysterectomy, the recovery time can be up to 6 weeks.
Now, is this something that a lot of your patients are familiar with, or is this something that's new? Because as you mentioned, the hysterectomy is the traditional treatment.
That's right. It's not well known in the community that this is a good option for uterine fibroids. Since I'm a interventional radiologist and specialize in vascular treatments, most of these patients present to the gynecologist, and they are often given just the option of hysterectomy or myomectomy, and may not be given the option of uterine fibroid embolization.
Now, is this something that insurance will cover as well?
Yes, all the major insurances cover this procedure and pay for it.
Now, you guys at Zenith Health and Aesthetics do have 2 locations. Is this something that you guys offer at both of your locations?
The main location is in Memphis at 6126 Poplar. That's where we do the procedures. I also see patients in South Haven and get them worked up for the procedure, but all the procedures are done at the main location.
Now, you did mention that this is kind of a one-time thing. Is this something that women continue to need to have monitored after the procedure is done? Actually,
no. The procedure is very long-lasting. Once it is performed, it usually lasts more than 10 years. I'll usually see the patients back once at about 6 months just to make sure that all the symptoms have been resolved. And then they continue just their routine gynecological care and usually have no more problems from uterine fibroids.
Well, Doctor, thank you for joining us today. We appreciate all the information. I know our viewers do as well. And thank you guys at home for letting me be a part of your Bluff City life. If you know, be sure to share your ideas with us. You can always send us a message to bluffcitylife@WMCTV.com, or you can find us on Instagram or Facebook. I'm Andy Maness, and we'll see you again weekdays at noon.